Hello, my name is David Goodkind. I'm a board-certified plastic surgeon since 1984 and the owner and medical director of FUZION Medical Aesthetic Boutique. In this short video today, I would like to enumerate the salient points of Connecticut's new medical spa bill passed just last year and its impact on patient care. Keep in mind that the legislature and the Department of Public Health are justifiably only concerned with safety. It is not in their jurisdiction to legislate who is more experienced and most capable to formulate your aesthetic care plan. The first part of the bill mandated that those administering or supervising higher level aesthetic procedures visibly post in their lobby or in any advertisement or website their level of training, expertise, and experience. Be sure to look for that. This was likely in response to the many previous practitioners not educated in medical aesthetics operating such practices unbeknownst to the naive public. The second part of the bill stated who exactly was technically capable and safe to perform laser and injectable procedures. RNs, PAs, APRNs, and of course MDs are so qualified. The third portion of the bill stated what level of medical doctor oversight was necessary for each type provider. A licensed APRN who has worked and collaborated with a physician for 3 years can legally run a medical spa and perform aesthetic procedures without any supervision whatsoever. A licensed PA requires a medical director MD to oversee in general, but can institute therapies without any MD immediate prior evaluation. Lastly, an RN can perform aesthetic procedures, but only after an initial evaluation by an MD director. Okay, so let's see how this works in real life. An APRN is a medical provider with a registered nurse degree and licensure who then completes 2 to 3 years master or doctorate degree in nursing. Aesthetic medicine is not a usual or required experience during these educational experience. After working under the tutelage of an MD for 3 years, an APRN can then own and operate a medical spa without MD oversight. No aesthetic experience is mandated. No expert experience, comprehensive aesthetic evaluation required or otherwise guaranteed. Now a PA. A PA requires 2 years of college experience, then usually some hands-on clinical experience. This is followed by a 2 to 3 year program of general medical and surgical physician assistant training. Again, aesthetic medicine is not a usual or required area of concentration during these years. A PA can then own and operate a medical spa but needs an MD medical director. Said medical director does not need to initially evaluate clients prior to their treatment. There is no legal stipulation regarding how much participation a medical director must engage in. Unfortunately, many of these spas hire a no-show, not involved, perhaps even a retired medical director just to meet the legal required standards. Again, no aesthetic experience is mandated, and an expert experience comprehensive aesthetic evaluation is certainly not guaranteed. Lastly, the RN, deemed perfectly safe to perform aesthetic procedures, must have their clients evaluated by an MD medical director prior to instituting therapy. The medical director, if a plastic surgeon, obtained a 4-year undergraduate degree followed by completing a 4-year doctorate in medicine. He or she then completes a 5 to 8 year residency, 3 or 4 years of which concentrates exclusively on aesthetic medicine and plastic surgery. The plastic surgeon must then pass a series of exams before becoming board-certified member of the American Society of Plastic Surgeons. Unlike the two previous scenarios, an experienced, expert, and comprehensive evaluation in this case is mandated and guaranteed. So with whom would you rather seek evaluation with prior to walking down the road to aesthetic and image improvement? Seeking treatment by the RN working in tandem with a plastic surgeon and not the solo APRN or PA assures you of an evaluation by a person and team with far more experience and expertise. You make your choice. You be your best advocate. We would so look forward to seeing you here for a free consultation at FUZION Medical Aesthetic Boutique. Thank you very much for listening to me today.